at entrepreneurial healthcare professionals then, why is that becoming more and more attractive to doctors as a career move? We've touched a bit on some of the hard decisions doctors are being asked to make about what do they go down one route or the other, but what's become the attraction?
Well, I think you have two types of entrepreneurial healthcare professional. You've got those who decide to step outside of the system and do something outside of their jobs as a clinician, perhaps leave the career path as a practicing clinician. And then you've got those who are innovating and trying to drive change from within the system. And certainly there's greater opportunity to step outside now and use technology to try and make some kind of change. And as we've talked about today, there's increasingly opportunities from within the system to get involved in innovation, and it's challenging. We've talked about a lot of the challenges, but I think this combination of there being a need and there being a lot more opportunity now.
No, I just think it would be nice if it was recognized like research. So, it's quite easy to take 2-3 years out for research, but it's not to do them for anything entrepreneurial. It still isn't, but I think it will be coming, hopefully.
And that was actually going to be exactly my point, which is, there's a very well-defined, always well taken up, to be perfectly honest, opportunities for doctors to get involved in research. And we have seen erosion in late-stage clinicians maybe being as involved in research as we would like in hospitals, because historically, you couldn't become a consultant if you hadn't done research, and now you can. So that's obviously a bit of a worry. But you can buy out time in your contract to get involved in research, and you apply for research grants to do that. 1 PA, 2 PA, 3 PAs. So it sounds to me like there needs to be more partnership working potentially between tech companies to engage in buying out of consultants' PAs to enable them to engage in, and not just consultants, SPRs, and other career level doctors. And we see that kind of engagement in the kind of the more life sciences, historically traditional life sciences, technology, biotech, pharma companies, where we have to engage in that way with doctors to get that research into new medicines happening. And it sounds to me that maybe tech companies need to look at how it works in the biotech pharma sector and say, okay, are there some of the models we can take, and can we have those conversations with the healthcare professional training schemes to recognise that as much as we recognise and value developing new medicines, we should recognise and value developing new technology.
Yeah, so I think the tech companies is interesting in how they can partner, but a lot of what we're talking about is can we be entrepreneurs within the NHS? Do we have to go outside, or can we straddle the two? But what about the concepts of actually, to support them, bringing almost entrepreneurs or technology people into the NHS to partner with the millennial healthcare professionals? Because I imagine if we look at what you've achieved, it's your kind of clinical expertise alongside someone who's very kind of technical and digital, and that's what's been as potent as it has. So it is a way of supporting millennial healthcare professionals by bringing in individuals into the organisations from like a tech point of view.
But the commitment, I don't know exactly how yours has worked, Matt, but that you say you're the oddity, but I actually think most of the innovation success comes when you mix one kind of skill set with another. And one of our problems with innovation has been scaling and change management. Like, we have lots of good ideas, but then who's going to be able to make the changes that are necessary, and can you build in a system that's going to be able to maintain itself during the implementation? Because failure at that point causes you big problems the next time you come in. So
the whole fail fast thing, when you quit a medical career for 14 years is a big ask. You really don't want to fail fast. You want to be kind of staying in there. And I think there's a big degree that I believe in health technology is stamina, which is, I think, which is a massive component as much as anything else. It's how much you can hang in there and just emerge, which we had some very rough years, but you just have to hang on somehow, keep the lights on, you come through. So providing the kind of environment for that, for someone to be able to commit that stamina to be able to flourish, I think is the name of the game.
Do we see a role there potentially for industry to be a bit more involved in terms of supporting entrepreneurial healthcare professionals?
I think insurers and pharmaceuticals and so on, they're very open. That's my experience. they're very open at accelerating ideas and integrating them and stuff.
I think they're often, my understanding, and you're probably much more able to comment, is that industry is still dipping a toe in a lot of the time to digital technology and transformation, and sort of trying to work out exactly how to work with health startups and how to use technology to change the game, but potentially are much more able than big healthcare systems to take some risks and to really be a very, very important part of the mix. I'm sure you know a lot more about how pharma's working with digital technologies and startups than I do.
But I think our industry has been slow to embrace that, and then I think some of the initial efforts were more about how do we advertise digitally than how do we serve digitally. And so I think there is a new push to be more how do we serve the patients and the providers that are interacting with our medicines in a way that will make our medicines more effective, right? So I think there's an opportunity for that, and you see more and more of it, I think, in industry, and taking the lead from either the medical entrepreneurs or it's a wide open space out there with the others that have great ideas, and you can go to New York, you can go to Silicon Valley, you can go to Cambridge. There are great places in multiple countries where it's exploding. And how do you find the ideas that are going to address our biggest problems? And somehow prioritizing those big problems, I think, is what we're trying to do within our world. And then who has the good ideas? Because somebody may have already thought about it at least 3/4 of the way, and mix in some of our expertise, we may be able to solve the whole problem.
The feeling I get, having had quite a lot of conversations with people in pharma and insurance and so forth, is that there's still a lot of exploration going on at the moment of how to use these technologies. Yeah. It's starting, but
and appropriately too, right? So that there is an element of what you know about your patients always can't be shared with others. So how do you intervene in a way that's going to be meaningful but still doing it the right way?
I was just going to say, just to add to that, in terms of the importance of the data and what you said about getting other industries involved, there is so much potential for pharma to gain from the right processes. If we take medication adherence, for example, I worked with a team of researchers, and we worked under Don King, who's now with DeepMind and Prof. Darzi, and we were looking at exactly this. How can we use smartphone technology to improve medication adherence? What systems can we put in place? And that in itself, if we we're working on now creating and developing this app, and by collecting information of who's taking which medication, are they complying, are they liking it, are they discarding stuff, are they using it as they should be? That kind of data helps not only improve the patient outcome, reduce the cost burden that we have on the NHS as well, but it provides such an opportunity for pharma to really come in and say, this is working, this isn't working, to connect with patients directly and say exactly, create a brand for themselves and connect directly with the patient to help them connect. Because at the moment, we take medications as we're given, but we have brand loyalties with other things, but we don't have brand loyalties to medications as such. And I think we can only build that if we're connecting directly and giving that information out as well.
I think there's a lot of what we're talking about when it comes to support is around the shift in technology, but I also think there's cultural shifts whereby the crowd is increasingly important, collaboration is really key. And I think historically there's been an anxiety on both sides of the fence, whether you're in healthcare or whether you're in the industry, to actually work together. But what I find really exciting is I think there's now much more of a willingness actually for people to work together, to collaborate, which I think will definitely drive progress.